She has so many projects going on, so we're just excited to have her. Please welcome the president of the African American Chamber of Commerce of Central Florida, Tanisha Nunn Gary.
Tanisha, you might be on mute.
Tanisha, if you can unmute your microphone so we can hear you, please.
Thank you. I had to get permission from the host to unmute myself. So thank you so much. Thank you. Thank you, Vanessa, and good evening, everyone. Happy International Women's Day. As Vanessa said, my name is Tanisha Nunn Gary, and I am the president and CEO of the African American Chamber of Commerce of Central Florida. For those of you who don't know me, I am a lawyer. I'm a very, very proud mother first and a businesswoman also. And most of all, I am dedicated to supporting the growth of Black businesses here in Central Florida. I work closely with other women on a daily basis, movers and shakers in Central Florida, executives, my beloved chamber members, many of which you will hear from later this evening, and my own staff. Even outside of my own journey, I know just how challenging it can be to navigate as a career woman. Did you know that women account for half of the US population, earn almost 60% of undergraduate degrees and 60% of all master's degrees? And yet, in 2021, there is still a pay wage gap between women and men's salaries. In 2021, men still hold an overwhelming majority of board seats. My point is that in 2021, we still have work to do to close the gap on equality in the workplace. And sadly, this gap was only widened by the COVID-19 pandemic. The pandemic amplified many of the challenges women have had to overcome for centuries, including availability of jobs, childcare, and fair compensation. First, let's briefly talk about the availability of jobs. You can't hide from the data. In 2020, men gained 16,000 jobs, but women lost 140,000 jobs. Which is even more gut-wrenching is when you realize that just last year, according to a CNN report, women held more jobs than men for only the second time in US history. Next, let's take a look at childcare. In society, women are often given the role as the primary caretaker and therefore often bear the majority of the responsibility when it comes to childcare. When the world shut down, not only did women have to think about their job security, but many mothers had to think about their children's welfare as their top priority. A survey by the Washington Post indicated that 1 out of 4 women who reported becoming unemployed during the pandemic said that it was because of a lack of childcare, twice the rate among men. Whether you are a single mother or in a dual income household, childcare is important. When we don't have it, it affects us personally and professionally, not just as individuals, but as an entire family unit. Schools and daycare facilities nationwide shut down to help slow the spread of the virus, putting a greater burden on a lot of moms to feed and provide educational support at home during the traditional working hours. Back when I was practicing law, I had to make many sacrifices. I turned down opportunities that required substantial travel because I knew I had to look after my son. He is the love of my life, and I wouldn't have it any other way, but these decisions did come with the cost. I walked away from opportunities that could have reaped financial rewards and increased our quality of living. In many cases, This would not have been less of a trade-off for a man in my position. Clearly, this was not a life or death situation, as many women are facing during this pandemic, but it was a life-defining enough moment to make me understand and empathize with the unique position that many women are put in today. I feel extremely grateful that despite those sacrifices, my career still progressed, but I know that depending on educational background, industry, and life circumstances, not every mother can push through for a positive outcome. Compensation. Not only did women experience more losses in 2020, but we also received fewer wins, specifically when it came to an increase in pay. Despite the tough year, a CNBC survey reported that roughly half of full-time workers said they actually received a pay raise last year. But again, the increase was not felt equally, as the majority of these raises went to men. As the president of an organization dedicated to the advancement of Black Americans, I would be remiss if I didn't also highlight that this gap is even more prominent in minority communities. Women of color were hit the hardest from the pandemic, as these communities already face systemic challenges. Women of color also held more essential jobs like hospital workers and grocery store checkout clerks, thus putting many of them on the front lines of the COVID-19 pandemic. Talk about stress on top of stress. As we rebuild, women will need specific support to get back on track in the workplace. Through the conversations that we will have in tonight's program, I hope that you will not only feel heard, but also feel empowered to speak up and rally together in spaces within your community or your place of work to help protect yourself and all the women around you. Thank you so much, Vanessa. I'll turn it back over to you.
Tanisha, thank you. And those were some very sobering statistics. So that is why what we're doing here tonight so very important. It's time for our panel now on the impact of COVID-19 on women. We will have a conversation with 4 amazing leaders from right here in our community who are both working to address the needs of women in the workplaces, and then in some cases experiencing the challenge of these times directly. So they'll have a lot to say. Before I introduce the panel, I want to make sure that those of you who are in our audience tonight, including those watching live on Facebook, that you know how to ask questions in our Q&A after the panel. You can interact by sending comments in the chat on Zoom, we've mentioned that, as well as posting a comment on the Facebook live stream as well. The questions will be answered by the panel or in the chat by our moderators. So we want to hear what you have to say and start this discussion this evening. We should have about 3 to 4 minutes of questions. So there you have that. Now I want to introduce the amazing panel I just told you about. First of all, we have Karen Willis, the Chief Executive Officer of the Early Learning Coalition of Orange County, Kelly Addison, Associate at Schenkel Schultz, Dazi Lenore, Esquire, Agency Owner, Producer, We Insure, Deidre A. Keller, the Dean of the FAMU College of Law, and Janie Lacey, Relationship Trauma Expert and Licensed Psychotherapist at Life Counseling Solutions. So we have such a nice variety, such a diverse audience there, people who are going to be chatting with us this evening. I want to start with you, Karen. Tell us a little bit about just an overview of the current state of early care and education in our community.
Thanks, Vanessa. I really appreciate you moderating this important topic tonight. Being one of the 3 most critical supports that Tanisha had mentioned, childcare, public schools, private schools, as well as before and after care that is available to support working moms, it's only fitting that we start with the state of early care and education, or as most people know it, childcare. Every working mom knows pre-COVID, particularly high quality childcare, was hard to find and quite expensive. Some studies report it costs more than a college tuition. And while vouchers are available for families working in low-wage jobs, as Pat had shared with us, the reality is those vouchers do not cover the full cost of care. Pre-COVID, according to the Economic Policy Institute, families pay 2 out of every $3 spent on early care and education. So the government sector is only a small portion of the cost of childcare for our American families. And that calculates to roughly $42 billion a year coming out of the pockets of families of the total $64 billion spent nationally every year for this very essential service. So who are the pre-COVID very lucky moms? Those were the ones who could afford a 5-figure annual childcare bill, or those who could qualify for Head Start and early Head Start services, which are Now let's fast forward to March of 2020, when over 40% of Orange County child care shuttered its doors. Roughly 90% of the network is back, but the Center for American Progress calculates COVID has increased the cost of child care an average of 47%. 47%. Add to that, in a study conducted in December of 2020 by the Coalition, 44% of respondents reported that without a significant increase in the number of children who were attending care, understand we're operating at about at less than a 50% capacity, and most sites are saying that they need to be operating at a 70 to 80% capacity in order to keep their doors open. In that study, 44% of respondents reported without a significant increase in children attending care or a significant infusion of federal funding, they would be closing their doors in 4 months. That was in December. We're 3 months in to that 4 months. It's true that a significant amount of federal dollars are part of the December 20 and the March 21 COVID relief bills, but none of that funding has found its way to the early childhood operators yet. The industry is indeed at a tipping point that at a time where businesses are looking to expand their payrolls, and without childcare, as Tanisha says, that's not likely to happen. We were able to afford and survive the first wave of COVID because we had sufficient hospital beds. Childcare is like hospitals. We have to be there before you need us. We're at a tipping point. Thank you, Vanessa.
So I want to also follow up with that, Karen. When you talk about providing accessible, affordable, and high quality childcare to working parents, particularly working moms, why is this important to the health of our economy in this community? Because it's an issue that affects us all, even if we don't have young children, even if we aren't working moms.
Very true. Very true. Tanisha spoke a little bit about it. And I know a lot of the panelists are going to talk a little about the impact of women leaving the workforce. But let me talk about the fact that childcare, it serves 2 purposes. The most obvious is reliable childcare allows parents to work because they know that their children are safe. It's that sense of safety that allows greater productivity, which positively impacts an employer's profitability, their bottom line. According to Child Care Action Campaign, US companies lose $3 billion annually as a consequence of childcare related absences. Access to reliable childcare has been known to decrease employee absences by 20 to 30% and reduce turnover by 37 to 60%. Huge, huge impacts. The second is the quality of the care received increases future academic and life success of children. A number of studies show that children who participate in high quality early learning programs are more likely to enter school with social, emotional, and pre-academic skills that translate to success in kindergarten, that lead to 3rd grade reading, that promote high school graduation, and increase the pursuit of post-secondary credentials. These types of successes lead to more family stability, home ownership, and increased employment in the life of the children who grow to be adults. The instances of accessing safety net programs like food stamps and welfare, and quite frankly, incarceration. So childcare Really, like I said, two purposes. It supports the current workforce while it prepares the future workforce. And both of these have profound impact on our community's current and future quality of life and economic stability.
Karen, thank you. I mentioned that we're going to talk about solutions tonight. So I want to hear from you, Kelly. How is your employer supporting you and other working parents with young children? Tell us about that.
I have a 2-year-old and a 5-year-old, and listening to what Karen spoke on, and how we went from having 2 kids in daycare. Our 5-year-old, she was in VPK at the time, and our 2-year-old was in a daycare, and we went from taking our kids completely out of school. Well, with Ava, we had no choice. Her school, closed and due to COVID. But with our youngest, we had the opportunity where we didn't have to send her back. And so our 2-year-old hasn't been in school, has not been to daycare in a year. At this point, we hired in-home care and kept our kids home. And then our 5-year-old does online school launch ed through Orange County. And so the only way we were able to do that, and to do that with an ease, and not feel the guilt, right, of being a working mom and trying to make it into the office and all of this, was having an employer that understands that they do have people with, employees with young children. And my employer, Schinkel Schultz Architecture, they have been very understanding with those of us that have young children, and have allowed, those of us, if we have kids that are at home, flexible working situations. We can work from home. I work from home a few days a week. And then also allowing some people, if they need to come in later so that they can get their older children set up on with school and then come in later, allowing us to have that flexibility. And by being an employer that you allow your employees to have that type of flexibility, and you're not putting a guilt trip on them about, being a team player and being in the office. It gives your employees, like someone else said, the ability to come in and be productive and not have to worry about, okay, if I need to work from home today, is somebody going to be upset at me, or is there going to be chatter in the office that I'm not efficient or not getting my work done, or that sort of thing. So I've been very fortunate, and I completely understand that I'm extremely fortunate that I have an employer that is understanding. And I also have a partner. One of our partners is a young mother of young children like myself, and so she is a voice for those of us. She's a voice at the table with the other partners for those of us who do have young children.
So based on your experience, what advice would you have for other business leaders in the community? You mentioned some of the things, but what can they do to make life a little easier for the working moms?
You have to allow for flexibility. I think everybody with children, you can have the best expectations and you can plan everything out the night before. And then you get up in the morning and your child will throw a wrench in the entire plan. And it just happens. It's life, right? So as an employer, if you're understanding to that and flexible with your employees will work harder, and there will be a reward tenfold on productivity with your employees. If so, flexibility, being understanding that things happen and that they come up. And not doing the whole be a team player and guilt tripping your employees.
So that is a perfect segue now to bring in Dazi to talk about, as a business owner, what can businesses do to support the working moms who are like Kelly, who are juggling a million things with 2 young children?
Well, we certainly understand the juggle. Hi, Kelly. And, I echo many of Kelly's sentiments, particularly around being flexible. I, as a working mother, would not be able to have kept our kids out of school and not felt that guilt that Kelly spoke about had we not owned our own business. So much like her babies, ours have not gone back since last March. So we've been doing homeschool. At first, we tried to do it from a, let's tag team. You go to the office for half a day and then I go for half a day, but then that becomes unproductive. So we ultimately brought our kids to the office. So they've had stations at our office since August. And as far as, being an employer, one of our staff is a grandmother, and her daughter was at home trying to work, and she had a 2-year-old. So the older kids would come with her to our office and do homeschool. So, at any given point, we'd have 6 babies in the office trying to get logged on to Zoom, and you run into all kinds of fun hiccups with virtual school. You've got, I can't get logged in, or I got glitched out, or mommy help me print this, or what have you. So, creativity, certainly understanding, giving flexible hours, if they couldn't get all their tasks done, then, being able to allow them to come in maybe at a different time, or maybe even after hours when it's quiet, so they can try to get stuff done. Letting folks work from home is also a really real consideration. I can't tell you how many times I've been on the phone with people throughout the course of our work throughout this last year, where you hear their dogs in the background, you hear their kids in the background. I've talked to folks with they're keeping their grandkids. I mean, people have all kinds of different scenarios and all different family units. And I think it's just really, really important to try to be considerate of what's going on, because this pandemic is real, and we didn't want our children to go back to school. So we've had to make some real sacrifices in order to try to continue to work and be productive while trying to maintain their safety at the same time. So I really feel like, as an employer, not to put that guilt on your employees, but to try to be creative and come up with strategies that are going to work for your employees, as well as to try to keep the productivity of your business moving forward.
Flexibility being the key there. Thank you to Kelly and Dazi. Dean Keller, I want to ask you about the impact of the pandemic on mothers who are pursuing higher education or training programs. What impact has that had on them trying to further their education?
Sure. So the pandemic has, of course, been really impactful for our students. Working students are impacted in several and varying ways. We have a part-time program here at the college, and I will say that I think the impacts have been particularly significant for them. A lot of them are parents. A lot of them are working parents. And so they're juggling all of the working parent issues and law school part-time. And so, as you can imagine, they have their hands very full. One of the major issues that they really faced was that where in the fall we were all remote. And for a lot of those folks who were working and parents, taking class from home really wasn't an option. They needed a space where they could be not at work and not at home with small children, and able to really focus on their classes. And so we had to open up the building a little bit for them. And that really gets back to what Kelly and Dazi were both mentioning about flexibility, right? That has been key in this whole process. And then the other issue that we've run into is high stakes testing. So in law school, there's lots of that, lots of high stakes testing, right? Your grade in a class might be based on just one exam. And again, that is a particularly difficult set of circumstances for parents who have kids at home and are also trying to take those tests from home. So that's an issue that we had to deal with around the bar exam, when the bar exam went remote in October and again in February, but even for final exams. And so again, we had to find spaces for those students to be able to take those high stakes exams without interruptions, and be a little bit more flexible in terms of rescheduling things and, scheduling exams in ways that were cognizant of the fact that not everybody has the same kind of home situation. And so those have been the major issues that we've encountered. And it has taken, just being open-minded and flexible and listening to people's concerns and adjusting as necessary.
And as a community, is there anything that we can do to support them or help them in a situation like that?
Yeah, I mean, really the thing that I have found to be so helpful is communication. And really, so hearing the students out, right? We have town halls, not unlike this one, twice a month with our students through the pandemic. And the reason for that is because we don't have them here in the building, right? So we can't just kind of talk to them on the fly. So we have to be really intentional about creating spaces where we can hear their concerns and adjust as necessary.
All right, Dean Keller, thank you very much. So now our final panelist is Janie Lacey. As a licensed psychotherapist, how have you seen the pandemic impact the mental health of working moms? Boy, this is ultra important.
Well, you said that, Vanessa. This is ultra important. When we heard all the issues and the challenges and the sobering statistics that not only Tanisha, but all the other panelists have shared, we know that without a doubt, there has been an impact. And there's several things that we are seeing, right? And one of the focal points is that we know that women are still considered the childcare and the domestic workers of their homes. And then you think about that woman who was in the throes of her career, was looking forward to all those things, and then the world stopped. And now she's a homeschool teacher. She's trying to figure out how to make sure that everything is working well in the home and trying to make a decision whether it's her husband or her, right? So we have seen such an uptick on anxiety and depression. And what happens when a mom is handling not only her family, but trying to figure out her own career, who's struggling with anxiety and depression, right? There's going to be preoccupation, and there's going to be all these other issues where she gets into survival mode. And we think about all the other things that we're seeing coming out of the pandemic with women, not only relational challenges, and these things are really real, finding out addictions in their family, teen suicide rates have been high, teen addictions have now been discovered. We think about going out of this, the job insecurity that has happened, and some other things that we've seen with our women coming out and continuing seeing with the pandemic is there's higher levels of loneliness. There's been a lack of support system. She's grieving losses, right? There's true losses. People have lost elderly families. They're seeing all types of things that are going on. And then when we think about if she's preoccupied, she has anxiety, she has depression, and then she's trying to manage her children, especially young children. They feel our energy. Our kids feel our energy. So then there's less time to really be emotionally available to our children. So there's these implications that happens when there's so much stress on us as females, as mothers, as providers. And we're seeing some of the biggest causes in the higher depression and anxiety is when there's a lack of support system, when she's the sole income, when she's the sole provider of her kids, and now trying to juggle all these different types of things. So, the mental health issues out of the pandemic, we're seeing it, we're considering it the second tsunami, right? And I think one of the things is having the support systems is more important than ever to provide treatment, to provide services, and that women need to know, especially women that may be hearing this, that there is nothing to be ashamed about, right? We see all these types of messages that we have to be super women, that we have to do all these other things, and all these memes that we juggle so many things, but there's a cost to that. And that cost is our mental health, which also affects our physical health, right? We're seeing so many women that are also having physical challenges as a result of what they're carrying mentally and internalizing the different things, because, right, we're taught that people can't see us sweat. So when we have these types of messages coming not only into the pandemic and out of this pandemic, it's going to continue. We're continuing seeing the challenges as a result of it, Vanessa.
And how do you think this is going to affect working moms or working women's just continuing to work, or does the mental health crisis just have more people just throwing up their hands like, I can't do it?
Well, what we're probably going to see is a lot of women who have not come forward yet are going to realize that they can't do it alone, and they're going to have to seek some type of help, because most people know they're having a mental health challenge internally. They know that they're not sleeping, there's insomnia, there's obsessive thinking, there's not only, I'm just talking about substance and alcohol addiction, we know the increase of rates of alcohol that have happened during the pandemic, but there's also food binge eating that has occurred. So for women, there's a higher level of addictive compulsive behavior in certain areas. So when we see that and then if someone's in a relationship, their partner or their husband will know that they're more snappy, that that there's more relational challenges as a result of it. And then there's more, when that happens, and there's also a rise in challenges as a family, teen behavioral issues, anger issues, all these types of things. So coming out of the long-term effects, what I'll see, or what I'm predicting is going to happen, is we're going to continue to have higher demands on mental health services and having a support around that. But there's also going to be a positive thing, Vanessa. And one of the positive things that I'll see that we're learning as a result of the pandemic is support systems and community matter more than ever, right? When I talked about loneliness earlier, you know, we see lots of women that talked about that when everything kind of shut down, who was there for them, right? They're figuring out things, everyone that says, well, what do you need, right? But they didn't have the support that they once thought they had. So those psychological isolation and those challenges. So one of the solutions that I'll see that women are now paying attention more than ever is financial security and preparing for that rainy day fund. And then also looking at their support systems a little bit different, like really who is there for you? If something was to happen, especially as a single mother, who is there for you? Who's going to take care of your children? So it's not only time to get our affairs in order, but to really think about our true support system.
All right, I think we have time for a couple of questions. And here's a very interesting one. How can companies help parents afford childcare? So I think for that, maybe if Dazi, you could weigh in, and then also Karen as well. We'll start with you, Dazi. Just from a business standpoint, what can companies do to help parents afford childcare once we get back into a position where people are sending children to childcare?
Well, I know that we certainly, extend benefits to employees, but, that can be a real challenge for a small business, as our resources, especially through the pandemic, have been impacted. And, we, again, look for ways to try to help. And our way was to just let them come. And we were the childcare. We were the environment where they came. But larger corporations, certainly could, to Kelly's point, offer some sort of flexible spending option where, they're not having to pay as much, or they can put some money aside. That would allow for their employees to try to cut those costs. But, having had, a baby in daycare, it can be very expensive. And there were no real benefits from any company that I worked for that was extended to me in that regard. At times the centers, especially when I was a very new lawyer, would offer a discount if you wrote a hardship letter or something along those lines. But as far as just offering other things, they weren't available. But again, some large corporations even have daycares on site. But for small businesses, that one's really tough to have those types of options available.
And Karen, can you weigh in on that as well?
We actually have a program that is sponsored through the state, matching program. An employer who would like to contribute to the cost of childcare for their own employees can commit dollars to the Early Learning Coalition. We in turn apply to the state for 50% match on that. So that is a possibility. We don't have as many businesses participating in that. That might be an option people might want to be thinking about in the future. Great opportunity to support employees. That would be one thing. Another idea, and one of the biggest challenges to this particular idea that I'm going to throw out is that families with very young children tend to take their children closer to where they work than where they live. When kids are school age, it's the reverse, because your kids are going to go to school, you've got before and after care, that sort of thing. But when children are very, very small, parents want to get to them if there is an issue. The other part being is that childcare will charge you money for every minute that you are late after their pickup time. So you want to be close to your child. But an employer could be looking at childcare centers that are in the close proximity, chatting with their employees about where are you taking your child, and look at some kind of partnership directly with that particular childcare center. helping to pick up some costs that might help then in turn for a scholarship of some sort for your specific employers. Providers are trying to be very creative. They want to support families as well. They know that childcare is expensive. So those would be two ideas that we have, and we would be more than happy to talk to any employer about the possibility of the state matching funds, if that's a direction they'd like to go in.
Another question, and Tanisha, I think this was one that maybe that you could address. More information or more stats on the gap between white and African American workers when you talked about that gap of employment and losing jobs and gaining jobs. Tanisha, if you can hear me, and unmute your mic, please.
Thank you, Lauren. Thank you for letting me come back. Can you all hear me?
Yes, we can.
Okay, Lauren, I also need permission to start my video again, please. So yes, you know, if you look at those statistics, Vanessa, was it between the wealth gap between whites and blacks?
Right.
Yes. So if you look at that, it really is going back decades. The black-white wealth gap today is a continuation of decade-long trends in wealth inequality. And of course, with the pandemic, we've seen that just widen. And I don't have the exact statistics on the overall wealth gap and how much it has widened, but in order for us to begin to even try to close this wealth gap, and this is where I will supporting Black businesses. When you support businesses, small businesses, they help, of course, build communities. And so I often like to say that small businesses and family-owned businesses are the cornerstone of any community. So we've all seen the recent hashtag support Black businesses, shop Black. When you do that, you are in essence helping to build a Black business, which in turns helps to build wealth within that family and close that wealth gap. So just want to plug to support Black businesses there. And then furthermore, to really for us to see a change in this racial wealth gap that we all have heard about and experienced for so many years, is going to take policymakers focusing not only on strengthening the safety net or the income, but really of changes that would come across a variety of areas to really close this wealth gap. So again, it's going to take policymakers making policies that will go against the systemic racism that we've seen experienced so much in the African-American community.
Vanessa, can I add an observation to
Sure.
that?
Sure.
The entire industry of early childhood is primarily operated by women and women of color. It's an industry that operates on a shoestring. It doesn't receive a lot of financial support. The teachers in the industry make anywhere between $8.50 and maybe $12 an hour. The movement towards $15 an hour is several years off. It's going to increase the price of childcare, but quite frankly, we're asking these women, and primarily women of color, to help our next generation of students be ready for kindergarten, for life success, yet we pay them as if they make less than folks that walk your dogs. So if we want to talk about wealth gap, we could start with the industry that we're counting on to keep our kids safe and ready for school.
Tanisha, I think this is another one for you to address. It says, we know that women have lost jobs at a higher rate than men, especially women of color. What can we as a community do to help women re-enter the workforce at higher paying jobs and achieve economic independence? That's a big one, but how would you address that issue?
Absolutely. I think now more than ever, we as women need to rally around other women and make sure that we are preparing them for whatever it is that they need, the skill sets that they need to be able to re-enter the workforce, and not only re-enter, but in different positions. You just heard from Karen, who talked about what these childcare workers are making just to come and take care of our kids. You can barely survive. They can't even afford childcare for their own children, based upon that salary and that income. So I think we have to look at making sure we work with women, work in communities so that we can provide resources, provide training, and provide opportunities for these women to have higher paying jobs. Because, you know, that is the only way that they're going to be able to do better, is to make more money. You know, we look here, even in Central Florida, there's an affordable housing problem as well. None of these families will be able to ever afford housing based on the incomes that they're making. So I think it's incumbent upon all of us to make sure that we're working with organizations to make sure that we can help these women develop the types of training that they need so that they can qualify and that they have the opportunities to apply for better paying jobs.
And I think we have time for one last question, and this is one for Janie. What has the emotional toll been on children, and how does that impact learning and future generations? We're talking about the toll of going through the pandemic and watching their parents go through the pandemic.
Absolutely. Or, you know, I don't have the statistics in front of me, but I recently read some statistics that showed the virtual homeschooling, that there was a decrease in grades versus those that were in the traditional system, right? So we know that that transition and that change, because, right, as parents, I remember last year also virtual schooling my own son, right? Never thought in a million years I would be a school teacher, right? So having to make adjustments as a parent, we can all understand that. Making adjustments, trying to figure out our own schedule, trying to get them on schedule, but yet you are the parent. So, you know, their level of attention and their level of obedience is probably a lot different. So when we think about our children, you know, the grades have been lost. There's a lack of interaction with other kids. There's sports that have not been able to be engaged with. So when we think about that, we've also been seeing some of the other statistics around higher depression, higher anxiety, higher aggressive behavior around our children. And with our teens in particular is what we have some of the statistics that will show higher suicidal rates. There's higher porn addiction. And a lot of times, you know, we see these types of things. Most parents are in the survival mechanisms of figuring out what's going on with themselves. And then when they figure out these things going on with their children, it's usually been going on for quite some time. So some of the problems that we've been seeing with our mothers, we've also been seeing with our teens and our young children as well.
All right, thank you very much. Thanks to everyone who joined us tonight and submitted questions and comments. So we had a really rich conversation. And again, talking not just about the problem, but about solutions and how as a community, we can all move this effort forward. Special thanks to all of our panelists, co-hosts, and partners for the valuable input on how we can support working moms during the pandemic. If you would like to learn more about the work of the partners to ensure that all families have access to what we're talking about, high quality, affordable childcare, you can check out the websites and you see the links there. So now I want to welcome back Tanisha for closing remarks, but we've had a great town hall this evening.
Yes, we have. Thank you so much, Vanessa, for leading our discussion, and thank you to all of our panelists. You know, tonight has truly been an eye-opener even for me. I thought that I had lived some of this and knew a lot, but just hearing from the panelists and reading some of the comments and questions in the chat, I think one thing we can all agree upon is we have some work to do. And, you know, we all have work to do in the community to make sure that we can lift up all of the women and make sure that we have a stronger society and community by making sure we help the women who really do bear sometimes the brunt of carrying the load for the family. So I want to leave us with this year's theme for International Women's Day, which is the hashtag Choose to Challenge. And this signifies the responsibility for one's own thoughts and actions every day. So let's all stand up and commit to choose to challenge and to challenge inequality. However, we can do that in our communities, in our places of work, in our own businesses for those who own businesses, and in our own homes. Let's make sure that we choose to challenge. There are a lot of resources that have been placed into the chat. I encourage all attendees to check out those resources and to reach out for help. As always, everyone stay safe. On behalf of the K-Ready community and our wonderful moderator, Vanessa Eccles, and all of our panelists, thank you so much for joining us, and we hope that you have a wonderful evening. Stay safe.
Good night.
Bye.
Good night.